All right. Welcome, everyone. Glad you could join me tonight. It's going to be a fun one. Going to talk about, obviously, a way that you can do anterior restorations, anterior cosmetic bonding in a much simpler, quick way. And so a lot of that is due to this great new injectable matrix system that's been developed by Veneer. I'm going to show you all about it. We'll talk about how it works. Obviously, down at the bottom is a picture of Dr. Atay Mishalov. He's the inventor and founder of Veneer. Pretty cool. He's a dentist in Israel. I'll talk about how I came across it and how we met and kind of how the stars aligned, and able to talk to you about it today. And really, you guys are at the forefront of this. This is actually, he's in Germany right now, getting ready to talk to people over there and introduce it over there. And you guys are some of the first people in the States to hear about Veneer, let alone learn how to use it. So I do want to thank Colteen. They're the ones that have paid my honorarium, as well as kind of partnered a little bit with Veneer. They do have a lot of amazing products. Sometimes you're probably using Colteen products and you don't even realize you're using them because they have so many different brand names, whether it's Sycan or Hygienic or Affinis or EndoIce. But they have a ton of products. Really great company based here in the States, out of Cuyahoga Falls, Ohio, which is really close to where I am. But in particular, I always use One Coat 7 as my universal bond, and I also use Brilliant Everglow as my composite. All the cases I'm going to show you a lot of videos and a lot of cases today, and they're all used with Brilliant Everglow composite. I'll talk about that composite, why it's so good. Essentially, it's brilliant. It's a nice composite in many ways. If you compare it to all the other composites that are out against Venus and Tetric, Chanial, it has a high gloss retention. It has very minimal wear, and yet it's not sticky at all. It has like some of the best testing compared to other composites as well, probably for a fraction of the cost. The benefit the most I like is that it's duo shade. Instead of having tons of inventory of composite, they've taken like an A1 shade and a B1 shade, and they've blended it together to make A1, A2, B2, or an A1, B1. So essentially, I only have 3 composites that I carry in my office. I carry the A2, B2, the A1, B1, and the BL. That's it. I use those for anterior, posterior restorations. And the reason why you only need that many is that it may be an A4 shade tooth, and if I use the A2B2 on it, it's going to take on the color of the tooth and it's going to kind of blend in. And I'll show you, like, this is a case. Clearly, I'm using A1B1 composite, but this patient's probably not A1B1. And here you do a little restoration. And then I was like, well, I can make that other tooth look good too, that lateral if you want. And so you put it over the dark tooth and it takes on the color of the tooth. She may not be A1B1, but in the end, it all blends in and looks perfect because of the chameleon effect of the Brilliant. So Brilliant Everglow is a really nice composite, and you're going to see that on display throughout this presentation, as well as how to use the Veneer matrix. I practice, I live about 30 minutes from Cleveland, so I'm a huge Cleveland sports fan, which is a good thing and a bad thing. I swear we always have like something going on. So the Browns are a mess, but I practice about 30 minutes east of Cleveland in Menor. I practice with my dad and my sister. They're both dentists, as well as my older sister actually has her own lab tech. So we have our own dental lab upstairs that she runs. But I actually live in Perry, Ohio. That's where I went to high school. So a little cool fact about that is the bottom left there, that's me, number 1. And then that's Brandon Staley, number 7 right there. And that's me right there in basketball, and that's Brandon Staley right there. And this is Brandon Staley right here. He's if you don't recognize the name, he's the head coach of the Los Angeles Chargers in the NFL. Isn't that crazy? So ended up being the head coach in the NFL Chargers. So hopefully he's got to win some more games. He's not like on a hot seat right now. But so but another thing that's crazy, little old Perry, Ohio, is then this guy down here, that's Todd. He never dated a single girl all through high school. then somehow he gets a job with like Fox Sports, wins an award, and gets the presenter of the award was Tara Lipinski. He ends up dating her, marries her. She won the Olympic gold medal figure skating. Isn't that crazy? Man. This is my oldest son, Benson. He's in 8th grade right now. That is a picture of me. Look at my arms in 7th grade. Look at him in 8th grade. It's crazy. There's like too many hormones in the milk. But that's my other son, Nolan. He's a good little athlete too. Fun kid. And then I have a little girl named Blakely. So the main thing about Veneer, about the injectable matrix that we're going to talk about, is really the plan of it is just to make things easier. If there's a way to make our lives easier and simpler as dentists, those are the things we need to do. We have a lot of things on our plate, whether we're owners or we're employees or associates, whatever it is. There's a lot of stresses that come in dentistry. And if we can find things that can ease the stress and make things easier and better, then obviously we can be happier, more productive, more profitable, more confident. There's a lot of benefits that come with finding the simple way to do things. Veneer provides a simple way to do anterior restorations, anterior cosmetic bonding, smile makeovers. This whole system, you get 128 matrices. It's a ton of matrices, right? So you get both of these, 128 matrices, and I think it's like less than $500. It's crazy. I'll show you. But this is how the box comes. And we'll go through tons of cases. I'll show you all the scenarios on how to use it, when to use it, how it works, all the odds and ends. But essentially, the process is simple. Try in the matrix first. If it's too tight to get in, that's when you can break the contacts, whether with a mosquito burr or an interproximal diamond strip, however you want to do it. Or you can cut the wings of the matrix, which I'll show you that stuff. And then all you do is etch the tooth, bond the tooth, then place the matrix, block out this lingual space, and I'll show you all these things so you'll have it by the time we're done. And then you just inject the composite, and then you disc the edges and polish. So essentially, just etch and bond here, put the matrix on, and then you just inject it with flowable. Really easy. And then it'll always end up being a little bit on the long side, which is better because then you just cut it down. It's always hard to add composite to length. It's easy to take length down. So it's going to be about a couple millimeters or millimeters long, and then you just disc it down. I'll show you. Here's a video to show it. There'll be a lot of videos as we go throughout this. I'll turn it down a little. This is me going ahead and just putting the matrix on. You can see it's kind of a tight fit. The benefit to that, with it being tight on the proximal edges, is that you're not going to have overhangs. So you'll always floss real smooth. And I blocked out the lingual space first. That way when you squirt the composite, it doesn't squirt out the back. And then you pull the matrix off. Everything's pretty much done. You can see there's a little flash on that came out on the bottom. And that happens, you just get it off, kind of clean things up. You can see sometimes that little dot. Sometimes you'll have a dot there from where the injectable spot was. Just go ahead and add a little flowable right over it and cure it. Sometimes you'll have the dot, sometimes you won't. Sometimes you'll have a little void, sometimes you won't. I'll show you how to fix all that and adjust all that as we go throughout today. But essentially, you can do these restorations in like 3 minutes. It's like in 5 minutes, you can be done with everything. But go ahead and take a coarse disc and clean up the edges. And then whenever I do contacts or like the interproximal areas, I always go to with a finer disc. That way you don't wipe anything away too crazy. So that's like a navy blue or a light blue, something like that, just to kind of. And then that's Shape Guard, which is an autoclavable polisher from Colteen. That's a really nice polisher. But essentially, that's start to finish, 2 little bonded veneers. She had some erosion on those, and so we just did 2 iVeneer injectable flowable composite veneers. I didn't have to prep those. We didn't numb those. They're kind of you'll see the system as we go throughout, but the system has all the anatomy built into it. So the facial anatomy is done. Your line angles are already done. Because of that, it's very predictable. Like, you know what you're going to get. So when you're doing it, you can reproduce these outcomes. Because of that, there's very minimal stress. It's very affordable for you. Like I said, like, and we'll get into cost, but even if you charged, say, $400 a tooth, which is very reasonable, or if you charge half the cost of what you charge for a lab veneer, the whole box of 128 matrices costs like $400 or $500. You're already profitable for the next 127 matrices. It's crazy. So it's so affordable to your patients. It's just a nice tool to have in your bag. And I'll show you all the benefits and areas that you can use it. The trend right now in America, for sure, and kind of worldwide trend, is that everyone wants a nice smile. There's these apps that you can have that will just give you that'll Photoshop your smile for you. Like that little baby up there. There's no way he has that many teeth. But you can Photoshop your own smile. And because of TikTok, Snapchat, all these Instagram, all these things, like, people notice when their teeth don't look nice, and they want ways to make them look good. They'll even use an app to just pretend they look good. We deal with this all the time, right? You see people that come in with terrible mouths, and you say, you're thinking they need dentures or whatnot. And all they're just like, oh, I just want to bleach them. Can I just bleach them? I just want them whiter. And we're in this world where people just want white, straight, nice teeth. They can see it with all their pictures they take. And that's due to the selfie era. More people have pictures of themselves than they do of other people. And so many people are taking selfies, or they're seen pictures of themselves in pictures, and they say, oh, I don't like the way my smile looks in this picture. And I don't like this about my smile. So patients essentially are driving treatment. The problem of it is we just got to make sure we're offering them options, right? So if they can't afford porcelain veneers and lab veneers, we need to have an alternative option where they can afford a composite veneer. And so it happens a lot. I think before I got into composite veneers, I would treatment plan veneers for patients, and there would be like a small percentage of my practice that could afford porcelain veneers and that would do them. And then I had a big percentage of people in my practice that wanted nicer teeth but just couldn't afford porcelain veneers. And those patients are just sitting in your practice. Every practice has those patients already in their practice. They're waiting for a solution that will fix their problem. And composite veneers is a nice avenue where it's not a ton of money, and it's usually half the cost or a little more than half the cost of a lab veneer. And they're like, oh, I can afford that. I can do that. And they're willing to do it. If you just offer the treatment, you'll be amazed at how many people are in your practice waiting to do it. Like I said before, they'll find other options. They want nice white teeth, and they'll find ways to make it look nice and white, whether they're good or bad. According to the ADA, the smile ranks as the most important physical feature of the whole body. You can see from this, the smile is more important than the eyes, the hair, and the body is the most important physical feature. Clearly, you can see if you don't have a smile that it just doesn't look right? So the smile is the most important part of the face. So it's pretty cool that we work in that area. We work in an area that has the most important outcome of the entire look of the face. So for those that can't afford porcelain or lab veneers, we should have additional options for them. Not only are patients driving cosmetic concerns with their smile, they also want things done like ASAP, right? They want things done yesterday, like whether that's a result of commercials about teeth in a day, but people want smiles in a day. Like they want same day smile makeover, same day bonding. those same day options are available when you're doing composite veneers. It's a simple same day procedure. So you can offer the benefits of getting nice white teeth and the benefits of something same day by enhancing your practice with eye veneer. I'll show you a lot of things about it. But the reason why direct bonding is a hot trend right now is because of those things. People want a smile that's improved and they want things done today. And so direct bonding answers both of those questions. And that's why you see things like Smile Fast. That was Smile Fast up there. BioClear has a matrix system. Their matrix system is only for the proximal edges. It's not going to do anything with the facial anatomy or the line angles, but people are milling their own direct resins. That's a 3M's new matrix that they just came out with called a Filtech matrix. You have to scan the patient's mouth and then they fabricate something and the patient comes back and then you do that. Obviously there's U-veneer and things like that, but the benefit to eye veneer is obviously cost, and you can do individual teeth. You don't have to do the whole smile. And I'll show you tons of cases. Essentially, the problem with direct bonding has always been that it's very technique sensitive. So it's tough and it takes a lot of time. I was at a course one time, the guy said he spends 90 minutes on a central, which I thought was crazy. And then I asked how what he billed out. And he said he has a flat rate that he charges. I was like, that's not practical for my office at all. It's like insurance-based, blue collar. Even if you Google something, like I Googled at the top right there, like about dental bonding, there's a question that says, how long does it take to composite bond 4 teeth? And the answer it gives up there is the procedure takes about 30 to 60 minutes per tooth. That's nuts. So then obviously if it takes that long, people are going to feel like they got to charge a lot to justify how long it takes. And then as a result, then they feel like overwhelmed and it's like, well, it doesn't look as good for what they charged. And that's the whole problem is it needs to be simpler. It needs to be quicker. It needs to be easier for you, right? And so this is why you're going to be doing cosmetic bonding in like less than 5 minutes a tooth. I'll show you. Even Dr. Christensen says direct bonding is a practice builder. It's going to be in the forefront. But that middle quote at the start says that aesthetically, nothing is more challenging to perform than a complex direct bonding case. Whew. Well, not anymore. So like I said, about 6 months ago, I was looking for, I don't even know how I came across it, but I was basically in some questionable dental Facebook foreign group or something, and I saw eye veneer. I was like, wait, what is this? This is pretty cool. So then I start searching it out. I find him, I reach out to him, I say, this was about like in June or May. I was like, hey, I have a lecture coming up. I'd like to try this if I can. And then they email me back. Next thing you know, I get this package from Israel, from Tel Aviv, Israel. And it's this. I open it up like, whoa, this is sweet. Okay. So then open it up. It comes with a small and a large. You get those 128 matrices in there. Has, premolars, canines, laterals, centrals. So then instantly I'm like, we got to try this. This looks awesome. So I say, like, call, we got to get a patient in here. You know anybody? And my secretary is like, yeah, my one friend. His front tooth's terrible though, but his teeth are bad. And I was like, well, we'll make it work. Bring him in. So here we are trying in the matrices for the first time. Like I said, I haven't taken a course. I don't know anything about it. Technically, eye veneer hasn't even been released, but I was just trying to figure it out. I just think it looked cool. I wanted to see what we could do with it. So I just built up the lingual here. And then you can see right there, I drew that arrow and you can see I didn't block this space out. See how there's a space in there? So then I went ahead and injected the flowable in there and you can see the flowable kind of track down this wing. It filled the eye veneer, but I just had too much excess go out the back. And you trim it all off when you're done. And so it's not the end of the world, but I just wasted some composites all. This is it showing again. See how I didn't block out the bottom. Like I said, I'm just learning on the fly here. but you can see it going in. You're like, oh, this is awesome. Like there's the contacts are nice. There's no overhangs. You have to angle it sometimes and squirt it a little bit different so you can get it everywhere, but you can see that little bit squirt out the bottom. And that's because I didn't block it out. It's not a big deal, but ideally, if you block that out, you won't have as much flowable squirt out. And I'll show you how. But here, in less than like 60 minutes, I did a whole smile on him and built up that tooth for aesthetics. Obviously, he needs a crown or something, but you know, it's been 7 months now, 8 months. He's still going strong. And so now what happens if you do it and the contact doesn't come out right, and maybe you have a void on a contact or you don't like the way one of the contacts look? This video shows how to fix a contact. It also shows how to fix just this one tooth. So this one really darkened tooth. So here, all we're doing is just a single tooth with eye veneer. We're going to lighten this tooth, and then I'm going to show you how to fix a contact that doesn't turn out right. And so this one you have to reduce because you want to get some opaquer in there to block out that dark shade. And then I didn't block this out. Again, I still was pretty new, but I would use my finger in there. And as this comes off, you can see that contact's not great. So all you got to do is just take a sectional matrix, put it in there with some flowable that you just used, and there, it's perfect contact, right? So what's cool with that is that case is a single tooth, so it's not like you have to do a whole smile with eye veneer. So it becomes a restorative option. Instead of spending all that time pushing composite and shaping up the line angles and getting the interproximals just right, you can just inject it like that and you're done. So it's a simple way to kind of fix a tooth and benefit your practice. Now, here's some ways on how to block out the lingual. It's easier if you block out the lingual. So that's step one. So like here's a class 4. Like instead of pushing composite around and getting voids, this is just simpler and faster now. I'll just take a Mylar strip, wrap it around, tuck it in the gum so I know it's, you know, nice and sealed. And then I just use the same flowable I'm going to use to do the eye veneer with, and kind of get it kind of close. So then you pull that off. You could leave it on if you want and cut the wings off the matrix. Or in this situation, I left the wings on the eye veneer because you can see them squirting out the back. And just squirt the flowable in and it's done. You can see again on this one, this was just like we were going to reposition 8. It was like a little sunken back. And so we just did a single tooth. And this was early on too. I wasn't blocking anything out. And it's not the end of the world, but you'll get some flowable that runs down the back. You just end up wasting a little bit of flowable is all. But the outcome's still great. You can see kind of the profile's nice. Another thing that's cool, an easy way to block it out is as I'm going to show you a lot of different things. So I start trying new stuff along the way, getting a little more innovative, trying to come up with different techniques. And I like this way a lot to block out the lingual now. This is kind of how I do it now. I'll try in the matrix and I'll do just some regular packable and then don't cure it. And then it'll all flow in together. But then your edge is basically your edge ends up being packable composite. So you just put it in, put some packable, uncured, and then flowable, and then cure it all one time once everything's in. But that's like, I mean, you could do little restorations like that in less than a minute. You know, it's so fast. Obviously, you get people that'll say things like, well, flowable isn't strong enough, you know, and it's a valid thing. It's something new. I think originally when you hear about flowable, you think, well, there's not a lot of filler content in flowable. So obviously you run a risk of it chipping or not being a permanent, you know, restoration. And so this was a from Dental Advisor, a study that was done on Brilliant Everglow Flow on the flowable that we're talking about here with Brilliant Everglow. And it says the minimal flexural strength of 80 MPAs is for load-bearing restoration. So that's the minimum, is 80 is recommended for load-bearing restorations. And Brilliant Everglow Flow is coming up at around 125 MPAs. So it's exceedingly strong. The regular composite is 125, and this is testing at 125.4. So very similar to the actual packable is the flowable. But even if you still don't think flowable is strong enough to use as an anterior restoration, which I was thinking the same thing. Sometimes I'd be like, oh, I guarantee there's some people that are going to still question, using flowable. And so then I was like, well, what if, because I like to use heated composite, and there's a lot of benefits to heating composite. Obviously, when you heat composite, you increase the kinetic energy of the particles inside the composite, so everything moves faster, which because of that, kind of increase in movement, you can get like maybe an increase, a depth of cure. So you might be able to get a deeper cure with the heated composite. But really the greatest benefit is that when you heat composite, the packable composite is going to become like the consistency of flowable, right? So then I was like, well, what if I did something else? So then I started tinkering around in my head, and I was like, well, what if I took the veneer matrix, I drilled a hole so that the compule could fit in it, and then I heated the composite, and then I used the packable composite that was heated so it flowed like flowable. And then you're using veneer with just regular composite, right? So this was the first time I was just trying this out. This is like the first in the world right here. And so now I don't have anything fancy when it comes to a heater for my composite. I actually just bought this off Amazon. It's like $30. It's like a coffee mug warmer, and it works just fine. What you want to do if you do that, if you buy one on Amazon, is just find one that has like a digital setting like that, where you can set it for a minimum of like 140 degrees. This one looks like it's at like 159, which my assistant was probably just cranking that thing up one day. But anything over 140 is the recommended. That's when the compule will actually kind of start to get a good consistency. So watch this. So this girl had number 7, lateral sunken back. She didn't want to go through with Invisalign for one tooth. And so I said, well, if you want, I could do a little composite veneer over that, just bring it out like a millimeter, couple millimeters. It'll look really nice. And then we don't even have to prep the tooth. If you don't like it, we can always take it off or whatnot. But it's real minimally invasive. And she was like all about it. So I drilled a hole. Make sure you drill a hole ahead of time, okay? And then put your compules on. Get them nice and soft, and watch this. So go ahead and etch and bond the tooth. And then try your matrix in first to see if you want to trim those wings off or not, or use the wings. There's the composite getting warm. And watch it go in. It's awesome. This was like the first time ever. I was like, oh, it works. But see it flow right in? So cool. So heated composite going in, acting just like flowable. And then all you do is pop the shell off and then trim it. And now that's packable composite, heated composite that was acting like flowable. So now you have all the benefits of veneer and all the benefits of regular composite. If you don't believe in using flowable, it's a great option. Again, even if you're doing posterior restorations, heating composite is like a total game changer. If you want to try this, I think it's a great method. So then once I did that one, I was like, all right, man, let's do a whole smile makeover that way. It's a little bit, just make sure you always drill a hole, a little bit wider so you can get your compule to fit in that hole. But watch this. So then I did a whole smile makeover with it. But watch that heated composite flow right in, and then it'll go right up, and it's nice and tight. All these, the eye veneer is really tight on the cervical. And then just trim it up, go around and kind of disc it and clean things up. But all your line angles are done, all your shaping's already done. I feel like because all of it's just flowing in together, I feel like I have less voids. And then because there's less voids and there's less little like imperfections, obviously then you'll get less staining. Now what was cool with him is this case is that he's like a big Instagram following. That's his thing at the top, that NeuroFit Nick. He's got like 60,000 followers or something. So then he made a really cool video about getting eye veneer, and then posted it, how he was self-conscious about his smile, and how and a lot of people are living like that, where they're living with something that they don't like about their teeth, but they don't know how to fix it. And if you can offer them options like this, and this is one that worked for him, is he couldn't afford traditional lab veneers. He always thought it was too expensive, and this was something that was very attainable for him. I think I have it that's my London Albrecht DDS. That's my Instagram thing. I just put that together. I just got on Instagram. I'm like a dinosaur trying to figure out all this stuff, but I'm on there. So if you guys are ever on there. So then I was like, well, I did heated composite packable and it worked. What if you use just regular composite, right? And obviously you can't squirt just regular composite in there. It won't squirt as good. But what if you just put it on the back of the company or the back of the eye veneer? So watch this. So obviously decay, build up the lingual, and then just squirt the regular cold composite right on and stick it on that way. Now there's no wings on that, so in order to make that work, you have to cut the wings off the eye veneer. And then I just have a Mylar strip going around, acting like the wings. That way I can keep good contacts. And then pull the Mylar strip out, pull the shell off, and then there it is, right? With packable composite. So not flowable and then not heated, but that's one way to do it is go ahead and just build up the lingual shelf and then just go ahead and squirt, cut the wings off, squirt it in, pack it in, right? It's fast, easy, and then it's traditional composite. Way faster than me trying to shape the composite. So another option is this one time this lady showed up and she lost her crown on the lower, and that's on a canine, and that's also is the spot of where her partial would hook to hold her partial in. And so I was like, well, felt bad making her pay for a new crown, and she wanted something fixed right then because she couldn't wear a partial. So I was like, all right, well, I took a anterior eye veneer canine and then put it on the bottom. Built up the lingual, and then went with heated composite. Look at all flow right in there, all the heated composite. And there she is, a composite crown. And partial fits just fine. And so she gets a composite crown. She's able to wear a partial again. And everything was fixed in like less than 30 minutes, right? These are the things that patients talk to their friends about. They're practice builders, and they're just a great thing to have in your practice. So then in one time I was like, well, what if we don't use the hole at all for the flowable? Watch this. So contacts are tight, cervical's tight, and just go ahead with the flowable. Go back and forth, kind of make sure you're filling it all in real good. I can tell it's really long, so I'm not going to fill the whole thing and waste all that flowable. I'm going to have to trim it back anyways. So go to kind of the length where you want it to be, and then just disc the rest, and that's a great little solution right there. So we ended up doing all 6 of her teeth. But that was an easy way to kind of shape everything up, make everything a little bit more proportionate. We didn't have to prep any teeth, no shots, didn't take anything away. We're just sticking the Ivanir matrix systems on and just injecting with flowable. Obviously, Ivanir is a great way to fix like contours and shapes and colors and closing gaps and spaces. You can fix shaping and alignment with it. Obviously, this was like a little repositioning, like that one tooth that central was sunken back a little bit. And so just go ahead and put an Ivanir matrix on it, inject it with flowable, pull it off, and everything's like, instead of just doing a regular class 4 on her, I was like, well, why don't we make it straighter for you too? You do it, you do that, and patients love that kind of stuff. Like I say, patients are like walking billboards for your practice. They can see what you do in the front of their teeth. Like you might do some amazing root canal on number 15, and the patient walks out and they don't know what you did. They can't see it. You do something on their front tooth, they walk out and they think you're either a really good dentist or a really bad dentist. And if they can see your front tooth and they can see the work that you did, you're like, man, he's good. She's good. Look what she just did. Like doing stuff with confidence in the front of the teeth and in their smile is it makes it's a game changer for your practice, and it's obviously a confidence booster for your patients. And so if there's a method that's out there that makes that process easier, why would you not want to use it? And that's why Ivanir is so great. Even if it's cavities and malpositioned teeth, you're like, well, we'll fix the cavities, and while you're in there, if we want, I can straighten things out and whiten things up a little bit while we're in there. Like, people love it, and you tell them how much it is, they're like shocked, because they're always expecting it to be as much as those veneers that they were quoted, and then you tell them something like an affordable composite veneer, and they jump at the idea of doing it. It's the broken central. And so then if you rebond that same little piece, then you're really only bonding to that one little broken edge. So if you pull that off and you build up the lingual, it's a little mylar strip, and then cut the wings off, see how there's no wings? So now it's just the form. So you use this mylar strip to act like your interproximal strip, kind of wings. Put the mylar strip there, cut the wings off, put the Ivanir over it, and then just inject. So now you've bonded to the whole facial surface. You're going to get way more bond strength because you're bonding to all this good enamel as well as that broken edge. So now that class 4 and that tooth is a lot stronger because you got bond strength on the facial side of the enamel and the broken edge. So then doing like extracted a front tooth, and we're doing bone graft, and like, well, I don't like my patients to be in flippers. Patients hate flippers. So I usually will try and bond in a tooth, and I also like that because then it's not rubbing against the bone graft. And so instead of sitting there and spending time shaping up a tooth with composite, I use Ivanir for this now. Watch this. And now this is with PRP. So if you guys don't know anything about PRP, obviously you could take the patient's blood and then spin it down in a centrifuge, and then you'll get the yellow plasma part and the red part will separate. And there's different ways you can do with it, but then I'll show you. Watch, it's pretty cool, but you can see how strong PRP is, or PRF, whatever you want to call it. So let's go in the centrifuge. You can see it come out. Look at this. That's the membranes, the PRF membranes. Look how strong it is. I could probably get 4 or 5 hemostats usually before it tears, but some Ribond, and then a little mylar strip to protect it when you build up the lingual, and then just inject it over once you've built up the lingual. And with something like that, because it's basically bonded to the 2 teeth next to it with the Ribond on the lingual, And then I'll usually take it a little shorter. I just don't want them to be hitting on it very much. But now that's in there, that's protected. Nothing's going in rubbing against the graft. But that's something quick and easy that I can do because I have veneers in my practice. I can just add that while I'm doing that, while I'm in there doing a graft. So eye veneer really just, it's another tool for your toolbox, something great to have in your practice. There are individual refills available. So if you run out of a central, you could just order these individual centrals. Kind of my polishing protocol is I always use like a red flame diamond to kind of shape up the edges or the cervical edge. Then I'll go with a coarse disc, the black disc, to get it kind of close on the length. And then I'll use like a navy blue disc to kind of do the edge, the interproximal line angle, corners, and like an enhanced pogo cup, and then some shape guard, and then like a little bristle brush just to get things shiny. And that's pretty much it. And you may see people in for bonding, like at a recall. Rarely are they really stained, but if you want to kind of touch it up sometimes, you can with a little pogo cup, an enhanced cup or something, or shape guard. Really, when it boils down to it with the flowable, like I said, that's brilliant flowable and brilliant flow. I talked about it before, how it has that duo shade principles, the flowable and the composite. And so I really only have like these three. I have A2B2 for like anything that's really dark. Like if it's A4, I use A2B2 and it looks like it's all A4. But I basically always use A1B1. That's pretty much what I use 90% of the time in my practice. And then if I'm doing a smile makeover or anything in the anterior, I'll usually use BL. And those are pretty much all you need. If you order BL or you order A1B1, you're pretty much always going to be set. That's what all those colors were that you saw in the presentation. They were all either BL or A1B1. Sometimes, like I said, you might get a little dot when you pull the form off. If so, you just add a little composite over that dot, and then before you shape it up. But it's everything's pretty much already done for you. You just clean it up a little sometimes. Now, if you do get a void, this is how you fix it, right? I'll show you how. So she's got these old crowns on 8, 9. So I'm just going to build up the lingual ear on these old, I think she had composites there or something that were broken that came out. And so it's like, if I'm going to do this, I'm going to bond to the whole tooth. That way it's a lot stronger. And then I can make it look like your front 2 teeth. So go ahead and inject it in. You can see kind of move the tip around to make sure that you're getting all over. But see how there's a void at the top? I'm not even worried about it. Just cure it and then pull the form off. And when you do, then you can go ahead and just add a little composite to that little divot. That's the best way to get to a void. Pull the form off and then just add to it. And then when something's not right, it's still an easy fix. And like that's the fastest class 4 you'll do. Like, right, they're easy. And something like that, like again, she had previous little fillings in there that came out, and she's got those ugly crowns, and now the crowns don't look as bad because you can kind of camouflage and make everything else look good with just 2 teeth, just 7 and 10 we just fixed with just eye veneer on those. Some troubleshooting stuff. Try and get through this so we can get to some questions, but really bonding and things like that. If something chips, the main answer and the solution to prevent things from chipping is to check the bite, always the lateral intrusive movements. Sometimes I'll have people back, like maybe come back in a couple of days, we'll do a little adjust and polish, and then just check their bite again. Sometimes when things settle down, check their bite, a couple of days later, it prevents something else from happening. If the matrix is long, don't worry. Just squirt it in the composite or the flowable and then trim it down. It's easier to trim the composite down than to add to length. It's always easier to take it away than it is to add. If you get a void like I showed you, just cure it, pull the matrix off, and just touch up the void. That's super easy. If it's hard to put the matrix in, that's when you got to either decide to either break the contacts with a diamond strip or a mosquito burr, and then just use the wings and put it on, or just cut the wings off and use like a mylar strip or something. The main principle, and that's even Dr. Ite's vision, is that his vision is to simplify cosmetic dental bonding process for the dentist and make advanced dentistry accessible to every citizen, clinic, and geographic area in the world. And that's why they were just in South Africa teaching people about eye veneer, and they're headed to Germany right now to teach people about eye veneer. Is basically, he wants it to be something that makes dentist lives easier, and that's exactly what it is. It's something that should be in your practice to make your life easier, but then to benefit your patients so that they can enhance their smile with not all the cost, right? So if you showed up because you needed a car and you went to the car dealer and said, I need a car, I want a car, and they said, well, you can get a Lexus, and you're like, well, I can't afford a Lexus, and they say, well, that's all, you only get a Lexus. If you can't afford a Lexus, you don't get a car. Like, and if patients say, I don't like my smile, and you only offer them lab veneers and they can't afford lab veneers, well, they're not going to, that doesn't make sense, right? So then if you can't afford the Lexus, they're like, okay, well, what about this Ford over here? And then that's another option, right? That's how it works at a dealership. And it's the same thing you should offer in your practice, is you should offer lab veneers. People that can do them will do them. And if they can't, say, well, we also have composite veneers. They're about half the cost or a little more than half the cost. And then you explain to them about those and the benefits and the pros and cons. And it's amazing. They sell themselves. Like I said, people are out there already in your practice wanting a nice smile. They just need to know what options are available. When you do anything on the anterior, you use an proximal strip afterwards, make sure you always polish in an S shape, right? That'll maintain the contact. If you polish in a C shape, you'll wipe away the contact. You'll get a little space again. So that's a little trick. So what to charge? I think a good option, a good price is whether you want to do like a 5-surface composite as a price. But I think that happy range is basically if you're $1,000 for a lab veneer, then maybe half or a little more than half, so maybe $400 for a composite veneer. And I'm telling you, like, you'll do these eye veneer composite veneers in less than like 5 minutes a tooth. Like it's something so quick and easy that it's added production to your office, right? So when you offer something, you can change composite, you can change impression material, to try and decrease overhead in your practice. But if you can offer a service, offering services is what increases production, right? So like if you weren't doing endo and you started doing endo, or if you weren't doing implants and you started placing implants, when you offer an additional service, you increase production in your office. If you offer composite veneers, like I said, those patients already exist in your practice that want nice teeth. They're already in your practice. So if you offer an additional service like composite veneers and say, hey, this is our new composite veneer, this is how much it is, your production's going to go up because you're offering a service. This is a service. It's not just like you're changing materials. You're offering additional service. So this is an area that you can increase production. So it's such a great thing. But not only that, you're able to just benefit patients. And there's nothing more rewarding in dentistry than like seeing a patient smile when you give them the mirror and they're like, oh, and they're like so happy. Like, right. So you change something, you change their confidence, you change something about their look, you made them feel better about themselves. And so it's the rewarding part of dentistry is the cosmetic part. It's just a thing that everyone should have in their practice. Like, I don't see why you wouldn't use it. At the top there is my email, and that's my cell phone. So you can shoot me a text. I get texts from dentists in California, Texas, Florida, Wisconsin, all over. Um, and I love it. It's fine. Text me if you have questions or how to do something, or shoot me an email. I can usually get you some answers. Let's see what time we got left. 9:21. Let's go to some questions. Let's go to questions. Well, I was going to show this just real fast. Some people will say, well, I do the putty technique. And that's kind of the closest thing to Ivanir. It's like their putty mold technique. But you got to do a wax up first. You got to pay for the wax up, and then you inject that clear guide in there. I'll show you this stuff another time. But let's focus on Ivanir. So let me get your questions. Let's do that instead, because we only got a few minutes. Let me see where I can find that. All right, so first one is somebody said, I started using Brilliant Everglow to replace Omnichroma. It blends beautifully. Great job. So I agree the same way. Like he switched from Omnichroma to Brilliant Everglow, and you'll get the same chameleon effect, probably a lot cheaper price too. How do you get the Ivanir to initially stay in place? That's where you just got to try it in. Try it in before you do anything. And if it's a good tight fit, you'll see it's pretty tight. Then just leave it and go with that. If it's not tight and you need to break contacts, if it does feel like it's loose, then you could put a wedge on each side of the Ivanir. So you just play with it and see what works. Somebody asked if it works for peg laterals. Totally works for peg laterals. Essentially just picture how I did that central on that kid at the first case I ever did. That's a lot like a peg lateral. What you want to do is build up that lingual first with flowable. Once you build up the lingual with flowable, then go ahead and put the Ivanir over the peg and then just inject it. But it's great for peg laterals. Why don't you etch and bond first? Yeah, you do. Always etch and bond. I just put the matrix in first because I want to make sure it fits. Once I know the matrix fits, then I'll etch the tooth, bond the tooth, place the matrix, and then go ahead and inject. Yeah. But initially, just try in the matrix just to make sure you like it, or if you have to cut it or adjust the contacts. How do you manage excess composite flowing subgingivally? Usually it doesn't. Usually the Ivanir seats really tight on the gingival margin. So rarely will you see it squirt out the bottom. That's why I put that one in there. It typically doesn't happen like that because it's really tight cervically. So you won't get composite going subgingivally. But if it does, like that one situation, then you can just, buzz it down a little bit. But typically it's a really, really tight bond gingivally. Just asked about the protocol for bonding with a universal bond. I'm big into etching. If it's a posterior, I'll selective etch, and then I scrub with that one coat universal 7, and then make sure that you air thin it. I think air to help the solvent evaporate's very important, and then I'll cure. That's how I use universal. Let me see some of these questions. Sorry. Have any patients post-treatment been hesitant to pay $400 for a procedure to take 5 minutes? Good question. So obviously, if you're doing just one tooth and it's $400, if it's 5 minutes into it, the whole thing may take a little bit longer. Like if it's a 30-minute appointment or whatever I've got, you'll adjust the contacts really good, shape it, polish it, maybe take a little bit more time if you want. But the outcome, they're thrilled about. And the alternative to this is them knowing that they would have to pay for a traditional veneer, which could be like $1,000. So if you're able to offer them something that's more than half the cost, they're usually thrilled about the price because the outcome is the same. It looks great, but yet way more affordable. So let's see. Let me see here. Are these Everglow composites bulk fill composites? So somebody was saying it seems like a giant increment to cure all at one time. Now, again, if it's a heated composite, okay, so if you take the composite and you heat it, you're going to increase the depth of cure, which means that even though it's not a bulk fill, I mean, it's probably less than 3 millimeters anyways, but there are studies that show if you heat composite that you can sometimes increase the depth of cure up to 4 millimeters, like a bulk fill. So, but yeah, typically the eye veneer is maybe 1 millimeter, 2 millimeters of material that's going in. So it's clearly more than capable of curing all the way through if you just inject it all one time. Somebody asked about Rib-On for that when I did that tooth, the temporary tooth with the bone graft. Rib-On's like a little fiber kind of wire, basically like a little fiber ribbon, and you can use that as strength just to kind of like, or if you don't have that, you could just use like a lingual wire essentially and bond to the two teeth next to it. Let's see, have you notice increased post-op sensitivity with polymerization shrinkage? Nah, not on these. So first of all those cases, it's really rare that I'm prepping anything or numbing those up. You don't have to really take away any tooth structure unless it's something that's really facial and you're trying to move it back or something like that, if you were doing a smile makeover that way. But as far as like sensitivity or post-op sensitivity with polymerization shrinkage, not in the anterior. Now, if you're talking posterior and obviously you're doing some large bulk fill back there, there's a lot more things that go into that. We can talk about a different lecture, how to reduce that. Is there no need? Yeah, so a lot of these are no prep, and how much to take out of the tooth. Somebody said they go Buffalo Bills. Yeah, well, Browns are terrible, so you have a much better team to watch for sure. You're lucky. Most resins today can be bulk filled. Yeah. Yeah, somebody asked if that mug warmer was off Amazon. Correct. I think it's like $30 on Amazon. Again, if you want to do that, I think that's the easiest way. You just put a couple compules on before you numb the patient or before you start doing something. After a little while, those compules are ready to go. Now, whenever you take a compule off of the warmer, if it's a heated compule like that, you have about 2 minutes to work with it. So you don't want to take it off and leave it on the tray for a while. So keep it on the warmer, etch the tooth, bond the tooth, and then right when you're ready to go, take that off, and then you're good. You want to inject that within two minutes. Once you take it off the warmer, it's going to it's got about 2 minutes before it starts to get hard again. Let's see. But yeah, I think I've got everything in there. But like I said, if there's a question I didn't get to, go ahead and just shoot me a text. That's my text, my cell phone, and that's my email there. It's a no-brainer to have in your practice. And like I said, if there's anything that's great about dentistry, it's when you get to change someone's smile and you get to see them feel better about themselves. Something about that instant gratification, same-day procedure. Take something, and in a short time later, you have something that's totally different and a lot better and a lot happier patient. And so, again, thanks for having me on. If you have any questions, just reach out. Thanks.